Hello and welcome to this learning module. Today we will introduce levels of pre-hospital EMS provider and review their respective roles and responsibilities. We will also emphasize the importance of professionalism in EMS. This video is intended to supplement any readings and coursework assigned by your instructor. The objectives for this learning module are: number 1, list the nationally recognized levels of pre-hospital care providers. Number 2, identify the knowledge, skills, and attitudes required for each level of pre-hospital provider. And number 3, reflect on the importance of professionalism in the field of emergency medical care. The National EMS Scope of Practice model is a part of an integrated, interdependent EMS education system that strives to increase consistency, efficiency, and clinical competence. Since 2007, the Scope of Practice model has given guidance to states by providing a national definition of the various duties or services provided by EMS clinicians at each of the 4 levels of national certification. These 4 levels are emergency medical responders, emergency medical technicians, advanced emergency medical technicians, and paramedics. According to the National EMS Scope of Practice model, the emergency medical responder, or EMR's, primary focus is to initiate immediate life-saving care to patients while ensuring patient access to the EMS system. Previously called the first responder, EMRs possess the basic knowledge and skills to provide life-saving interventions while awaiting additional EMS response. In many areas, EMRs may be public safety responders such as law enforcement officers, firefighters, park rangers, ski patrol personnel, or other responders who arrive on scene prior to the ambulance arrival. EMRs must complete anywhere from 60 to 80 hours of training prior to testing for this credential. EMRs rely on an EMS agency to provide higher level care and transport of patients. In rural areas, EMRs may be the only care personnel for prolonged periods while awaiting for the arrival of an ambulance staffed with higher levels of care. EMRs may assist, but should not be the highest level person caring for a patient during ambulance transport. Since EMRs are often the first to arrive on scene, they are trained to quickly assess patient needs, initiate treatment, and request additional resources. EMRs are also trained in cardiopulmonary resuscitation, or CPR, and the use of an automated external defibrillator, or an AED. In summary, emergency medical responders function as part of a comprehensive EMS, community, health, or public safety system that provides clinical protocols and medical oversight. EMRs are trained to perform basic interventions with minimal equipment to manage life threats and emergencies until other EMS personnel can arrive on scene. EMRs are an important link within the 911 and emergency medical service systems. The EMR is not currently recognized as a certified level in South Carolina and therefore does not fall under South Carolina laws and regulations pertaining to EMS. In the image here, an EMR from the Illinois Air National Guard evaluates a simulated victim in a training exercise. An EMT is a health professional whose focus is to quickly assess patient conditions, provide stabilizing measures, and request additional resources as needed. EMTs are basic life support, or BLS level providers who often have the capability to provide medical transportation to an emergency or other healthcare facility. Depending upon a patient's needs, EMS system design, and availability of resources, EMTs are sometimes the highest level of care a patient will receive during an ambulance transport. In South Carolina, EMTs must complete a minimum of 200 hours of classroom, lab, and clinical training prior to certifying. Examples of EMT interventions include patient assessment and history taking, bandaging and splinting, use of an AED, basic airway management techniques, and administration of certain emergency medications, including EpiPens for allergic reactions and nitroglycerin for cardiac chest pain. EMTs may be paired with higher levels of personnel as part of an ambulance crew or other responding group. With proper supervision, EMTs may serve as a patient care team member in a hospital or healthcare setting to the full extent of their education, certification, licensure, and credentialing. In a community setting, an EMT might visit patients at home to make observations that are reported to a higher level authority to help manage a patient's care. When practicing in less populated areas, EMTs may be the only care personnel during prolonged transports. EMTs may provide minimal supervision of emergency medical responders. To summarize, EMTs function as part of a comprehensive EMS, community, health, or public safety system with defined clinical protocols and medical oversight. They perform BLS interventions using the basic equipment typically found on an ambulance to manage life threats, medical, and psychological needs. EMTs are an important link within the continuum of the EMS system from a pre-hospital response through the delivery of patients to definitive care. EMTs are a recognized certification level here in South Carolina. In the image here, we see two EMTs loading an injured patient who sustained a skiing injury for transport to definitive care. Advanced EMTs are skilled health professionals whose primary focus is to respond to, assess, and triage non-urgent, urgent, and emergent requests for medical care. AEMTs apply basic and focused advanced knowledge and skills to provide patient care and medical transportation. Advanced EMTs also facilitate access to a higher level of care when the needs of the patient exceed the capability level of the advanced EMT. Here in South Carolina, applicants for an AEMT training program must be a certified EMT. The additional preparation beyond EMT prepares an advanced EMT to initiate interventions beyond those authorized for BLS levels. Examples of AEMT interventions include obtaining an intravenous or IV access, cardiac monitoring and manual defibrillation, advanced airway techniques, and medication administration beyond the scope of an EMT. AEMT training in South Carolina requires a minimum of an additional 248 hours of classroom, lab, and clinical training beyond the EMT level. In areas where paramedic response is not available, the advanced EMT may be the highest level of EMS personnel a patient encounters before reaching the hospital. With proper supervision, advanced EMTs may serve as a patient care team member in a hospital or healthcare setting to the full extent of their education, certification, licensure, and credentialing. In a community setting, an advanced EMT might visit patients at home to perform assessments and make observations that are reported to a higher level authority to help manage a patient's care. In summary, advanced EMTs function as part of a comprehensive EMS, community, health, or public safety system with medical oversight. Advanced EMTs can perform interventions with the basic and advanced equipment typically found on an ambulance and may perform focused advanced skills and pharmacologic interventions designed to mitigate specific life-threatening conditions. Advanced EMTs are also a recognized certification level here in South Carolina. Paramedics are health professionals whose primary focus is to respond to, assess, and triage emergent requests for medical care. Paramedics apply basic and advanced knowledge and skills to determine patient physiologic, psychological, and psychosocial needs, administer medications, interpret and use diagnostic findings to implement treatment, provide complex patient care, and facilitate transport to an appropriate level of definitive care. Paramedics work in a variety of specialty care settings, including ground and air ambulances, and occupational, in-hospital, and community settings. Academic preparation enables paramedics to use a wide range of medications, medical techniques, and monitoring devices to evaluate and care for sick patients. Paramedics are skilled clinicians who utilize critical thinking skills to make complex judgments, such as the need for transport from a field site, alternate destination decisions, the level of personnel appropriate for transporting a patient, and similar judgments. Paramedic training goes well beyond that of an advanced EMT. Paramedics are trained to interpret cardiac rhythms and identify abnormalities in 12-lead ECGs. Paramedics can also use advanced electrical therapy beyond defibrillation to correct cardiac dysrhythmias. Paramedics can administer many of the same first-line medications administered in the emergency department to stabilize an emergent victim prior to transport. Paramedics receive extensive training in advanced airway management techniques, including endotracheal intubation and surgical tracheostomy. In South Carolina, paramedic candidates must have an active EMT certification and are required to complete a minimum of 1,000 hours of classroom, lab, clinical, and field training. Paramedics often serve as a patient care team member in a hospital or other healthcare setting to the full extent of their education and credentialing. Paramedics may work in community settings where they take on additional responsibilities monitoring and evaluating the needs of at-risk patients, as well as intervening to mitigate conditions that could lead to poor outcomes. Paramedics help educate patients and the public in the prevention and/or management of medical, health, psychological, and safety issues. Additional training and credentialing available to paramedics include flight paramedic, critical care paramedic, and community paramedic. Paramedics are the highest level of pre-hospital care provider and are a recognized certification level here in South Carolina. In the image seen here, we see paramedic students simulating a cardiac arrest scenario as part of their initial training. EMS is a profession, and EMS providers are trained professionals. The Merriam-Webster Dictionary defines a professional as a person with a high level of knowledge or skill in a field. Our field is healthcare, making EMS providers healthcare professionals. The World Health Organization, or WHO, states that health professionals maintain health in humans through the application of the principles and procedures of evidence-based medicine and caring. Study, diagnose, treat, and prevent human illness, injury, and other physical and mental impairments in accordance with the needs of the populations they serve. Advise on or apply preventative and curative measures and promote health with the ultimate goal of meeting the health needs and expectations of individuals and populations and improving population health outcomes. Nowhere in any of these definitions does receiving a paycheck have any bearing on the definition of a professional. Many EMS providers begin their journey as community volunteers. Some may go on to take paid positions while others may not. Whether a provider receives a paycheck for their service has absolutely nothing to do with their status as a professional. All EMS providers are healthcare professionals, and we must always represent our profession accordingly. The 5 values listed here are known as the I CARE values and are the cornerstone of the EMS profession. These values evolved from an EMT lecture on values and ethics in 2004 at the Santa Rosa Junior College EMT program. Let's review the definitions of these 5 values. Integrity refers to someone who adheres to a code of moral values. This is an important characteristic for an EMS provider because we are entrusted with sensitive patient information, patient belongings, and patients' lives. A compassionate provider is one who is concerned for the suffering of others and wants to alleviate that suffering. Accountability refers to the ability to take responsibility for your words and actions. For EMS providers, this means we don't make excuses or blame others. As pre-hospital providers, we must be respectful and professional to all we encounter and in all situations. This includes patients, bystanders, other public safety responders, co-workers, and our healthcare partners at the hospital. Lastly, empathy refers to the ability to be aware of and sensitive to the thoughts and feelings of others. Additional professional attributes include self-motivation, appearance and hygiene, self-confidence, teamwork, and effective communication. A successful EMS provider will embrace each of these attributes. The University of South Carolina School of Medicine Greenville was the first medical school in the country to integrate EMT training and certification into their first-year curriculum. Once certified, medical students work one 12-hour shift a month on ambulances and in the emergency department to help build communication, focused patient assessment, documentation, and patient safety skills. This experience enables students to link classroom learning to real-world clinical settings. This brings us to the end of this presentation. Here we see the learning objectives for this module. Can you demonstrate each of these objectives? If not, please consider going back to review any content that you struggled with. Thank you for watching this learning module.